Nassif, good to see you. Thanks for joining us at the Hydra Facial Studios. You're our first guest, and I couldn't be
First
more pleased.
podcast.
First podcast.
I love the first. I love to tell you, I love this building. Cool. Everyone I've met is incredible, and of course you, my friend. Love being here with you.
Hey, thanks. Well, thanks for coming in. Real conversational, and it's just a lot of fun having you here. We've been doing the taping today. I think you're getting a Hydra Facial later on.
Yeah.
We're launching NassifMD and the awesome serum that you've created. So, why don't you tell, for those of you who don't, if you don't know Dr. Nassif, that's incredible because most people on the planet have seen you on TV or aware of your product. But maybe tell us a little bit about yourself, where you grew up, how you ended up becoming a plastic surgeon and an entrepreneur.
Okay, fantastic. So, I was born and raised in Los Angeles.
Okay.
And interesting, my uncle was a GP, but back then, general practitioners were doing surgery. So I used to always go into his office and help clean. And of course, my mom at the time said, my son, the doctor. And so she kind of like, actually it does work.
It does.
If you kind of direct your kid, you're brainwashed. And then my sister started doing it. And the funny thing is, I remember in high school, I was 12 years old. I remember a note from my schooling that I'm going to become a doctor.
Wow.
So the point is, it started pretty early.
Yeah.
And interesting, I'm a facial plastic surgeon via the route of otorhinolaryngology, ENT, because I used to go watch this famous ear surgeon do ear surgery. And so I got interested in ear, nose, and throat. As a matter of fact, when I was doing my residency in head and neck, the first part I already was dialed into what we call neuro-otology, which is ear surgery and skull-based surgery. In other words, tumors that involve the back of the ear near the brain. Wow. All microscope. Mm-hmm. And I was into that. And then I remember during my fourth year, right at the beginning of my fourth year, where you go 5 years, I started working with the facial plastic surgeon doing our rotation. After the first week, I said, I'm in. I'm all in. Yeah. Because of the facelifts and the noses, I just loved it because part of, ENT, 20% of it is facial plastic surgery. Sure. And so then I ended up doing a fellowship in facial plastic surgery with a pretty well-known guy named Dr. Regan Thomas in St. Louis, Missouri. Yeah. And that brought me out to, since I was raised out here, immediately back to California. And it's now been about 21 years or so. And I had for the first 15 years, I think, I had a partner who's a dermatologist. Mm-hmm. And of course, now we have, NassifMD plastic surgery. And, I got into the TV aspect of it pretty early. In the beginning, when I came out to California, opened my practice, so maybe say in 1999.
Sure.
Or 1998, I started doing stuff, opening up my own office in 99 in Beverly Hills. Okay. I'm in the same building, but moved offices, escalated and got, a little bit bigger. It was interesting. I started doing TV stuff back when TV makeovers were in.
Sure.
And this was in the early 2000s. Extreme Makeover and all that. And sure. I started doing, for Entertainment Tonight and Extra and all these kind of things. So I had a publicist, so I started doing TV back then.
Okay. A little controversial back then, right?
Not.
Did you have a lot of frenemies that came out?
Yeah, the interesting thing with our academy, they go, "What are you doing on TV and stuff?" But you're right. You create a little bit of that. As a matter of fact, that Frenemies is perfect. So it was a little bit, and then I got on this Dr. 90210, but only for a season.
Okay.
The only reason why I was for a season is because they wanted to do more family stuff. And at that time, when I was married and I had my young kids, my 3 boys, we didn't want to do it.
Yeah.
No way. So from then, besides having my practice, the TV kept going, still doing my little makeovers, which are doing well, actually, you know, and doing, with news, like a new way to use Botox or whatever it was.
How does that work, actually? I've always been, I'm a little bit of a reality TV junkie, but when it comes to something as serious as surgery, describe a little bit behind the scenes there, what's happening versus the action and them filming you.
You mean but that's the real stuff with botched, you mean?
Yeah, well, botched
is that what we're talking about?
Yeah, but on those original extreme makeovers, everybody in the family's crying because you're seeing this person transformed. Mm-hmm. What's it like taking care of those patients through that journey and working with the teams during those seasons?
So, you have a whole production team, and usually what would happen is the family and the patient would always be with a producer. This is like for Dr. 90210. which kind of the same thing that's going on now, but maybe more expanded. And when you have a patient and you're doing a makeover, whether it's a trauma patient,
Yep.
Whether it was a domestic abuse patient, whether it's just a good old simple face makeover, and someone who maybe got divorced and wants to stay looking young or had some traumatic incident in their life. When you take that person or you put them back to normal, especially with their nose,
Mm-hmm.
you put someone back to normal and try to reestablish normalcy, or normalcy, I should say. When you try to establish normalcy, back to someone who is actually, their face has been devastated and they're not the same person anymore.
Yeah.
And then you see them react, you see them cry, you see them feel good, you see the transformation. It's fun.
Yeah.
And it makes you feel good.
Yeah.
Besides you doing fun surgery, and as a surgeon, you enjoy that.
Yeah. Tough cases, right?
The tough cases, you enjoy that, but then what happens is when you can make a difference in someone's life, even though you're not saving someone's life physically, but sometimes you actually are saving someone's life psychologically with what we do.
Yeah. Growing evidence. I mean, even in non-invasive aesthetics, there's that correlation people are starting to understand. These aren't shallow treatments. These are things that make people feel confident, help them in their career, help them make more money. So I can't imagine when your face is your calling card and something is devastating happens, and what it must do to somebody's self-confidence is incredible.
Oh, yeah, so, that's fun.
Yeah.
So that's how that started. Then it grew to, being on the Housewives of Beverly Hills for about 4 years.
You got to have great stories from that. Probably you can't even tell me those stories.
Well,
but
no, but you saw it all. All they do was fight.
Wow.
A lot of fighting, and actually, we got off it because we had some, conflicts and some things they didn't do that was not so nice, and in dealing with, some of these cast members. And so that was the end of it. And actually, that also was the end of my marriage.
Wow. No kidding.
Kind of helped push that off to the side there.
Yeah.
And
those shows never are designed to make you look good, though, right?
Not really.
Yeah. It's interesting, though. I was at a dinner maybe a year and a half ago. I mean, we're in the middle of the pandemic, so I think I lost a year of my brain. But somebody said, Dr. Nassif, now which one's he? And the counterparty said, he's the one that's always seems like he has high integrity and is a great guy. And I thought as a physician,
now
that's what you
Botched.
want. Yeah,
Right.
absolutely.
Well, Botch was a different level, and Botch was my idea.
Okay.
Cute little story. I'm having dinner in L.A. with the two producers, the main guys that do all the Housewives shows, did mine in Orange County and all these other shows. And I said, it's time, and we already were off the Housewives. I go, it's time to do another plastic surgery show. We got to do something.
Yeah.
And so we started that idea. Then I called the other guy, Terry DeBro, and we did a 5-minute, scissor reel, it's called, and E picked it up just like that.
No kidding.
And now we're filming season 7.
Wow.
But yeah, out of that show, I hope that I'm the one, that comes off. I'm the more serious one.
Well, you come across like you do
integrity
in person. I mean, when I see that, I feel like very much you're the same person on screen as you are off screen, which I think is a real testament to you.
Yeah. I mean, you're not an actor. You're up there doing it.
Yeah.
You're talking to patients, and you're, the interesting thing that happens with that is in the beginning when we did this, we had 500 people try out for the first series, and now we have over 10,000.
You're kidding me.
At season 7, which we're filming now. And then your skill set. I've always been a revision specialist, especially in the nose. But your skill set goes like that as you're doing these very difficult cases from all over the world.
Do you feel more pressure being under scrutiny, knowing that this will be seen by the world, or does it, you're
in the beginning when you do surgery on TV, of course, you're scared. Because what happens? Now we show complications.
Yeah.
We really discuss and show everything that's going to happen and why it's dangerous and what can happen, and we put it out there.
Yeah.
And so, no, and actually, if it happens, it happens, and I want people to show it's a learning experience. It's a cautionary tale of what to do, whether it's with your face, your body, non-invasive stuff, the things not to do. We've actually, of course, have had HydraFacial numerous times on the show.
Yeah.
Especially, I got it now on this season. I got to get the Hydraglucan in there and
absolutely
my booster. In
yeah,
there
we'll put a
that.
plug. We'll just have it behind like the Coca-Cola bottle there the whole time.
Yeah, I'm using my booster here.
Yeah, exactly. And I know family is important to you. I've had the pleasure of meeting your family, except for one individual who has arrived fairly recently. So how are things going on the home front there?
My baby Paulina, little girl, she is 3.5 months. And even I'm a little bit older, but being a dad again, especially I can appreciate it more now. I'm a little bit older. I'm a little bit more settled in life because I have 3 boys and they're all teenagers. I love it. So
That's
thank
awesome.
God everything's going well. My wife, been married now for, let's see, well, only a year and 4 months.
Yep, that makes
And
sense.
so happily married, happy with the kids, happy with the baby. Thank God
Everybody's healthy.
everyone is healthy.
It's great. And the best thing about that is when you have 3 boys as a dad, you're not sure you'll be taken care of in old age. But when you have a daughter, you're set now. That was
Oh,
very,
thank you.
very well timed.
That's right.
Good. Well, I thought maybe we'd switch to talking a little bit about, you've got, the way I count it, 4 jobs, right? You're a facial plastic surgeon.
Mhm.
You're a TV personality.
Mhm.
You've got your own business. You're a family man. You're a busy guy. And you seem to do all of them extremely well, at least from my standpoint, looking at you as a friend. But we've got a lot of our customers that are really small business people. We don't call them that because we're in the business of healthcare.
Mhm.
But when we have people come into HFX, a lot of their questions, once we get them past the HydraFacial training and skincare training, is, hey, how do you do this with business? How do you do that with business? Any thoughts maybe that we can share with some of the small business owners? I mean, you've as a physician, you had to start this by hanging a shingle, and
Mhm.
I think it'll be interesting to find out, what spurred the idea of NassifMD and deciding to take this out to the world. But what's your advice first on getting into small business? Should somebody even do it?
I think that the only reason why you should not get into small business is if you're not motivated.
Yeah.
No matter what, nothing comes easy.
Yeah.
If anything comes easy, it's not going to happen. It's not real. It's temporary, or it's going to fail.
Yeah.
And I realize that as a small business owner, you can't stop, even if it
Yeah.
takes a long time, whether it's 1 year, 5 years, 10 years.
Yeah.
If you are doing something that's true to what you want to
Yeah.
achieve, whether, you have to have a good product. Because let's say you do the right marketing, and let's say it's social media, and you do whatever that is. Let's say you're a spa owner.
Yeah.
Okay? And you're doing the minimally invasives and the injectables and, of course, the HydraFacial. And you have excellent people around you that make you as the owner look
Yeah.
good, that have integrity and have great skills and technology, and good with actually the clients and the customers, and doing everything the right way. Again, biggest thing is trust, integrity, but you got to have some OCD. You have to have that.
Yeah.
You have to be hands-on.
Yeah.
Watch what's going on. I think if you do that, no matter where you are, even though it might be slow, especially in the COVID era now,
Yeah.
and I think that's going to change the landscape probably for the next 10, 15, 20 years maybe.
Yeah.
I think that is the way to go. And you can start small.
Yeah.
Don't overdo it, and then build, especially with reputation. Because once you get a customer in the door, let's say through social,
Yeah.
through advertising, whatever it is you want to do, you got to keep them.
Yeah. Yeah.
So you know that.
No, it's wild, right? It's the hardest thing to do. I mean, the companies that spend millions and millions of dollars of marketing, we have a value system out here, and it says the customer is number one, really, and it's capitalized. Because the countless times I'm a consumer and you pick up the phone, you call into their customer care, and it says, "Dear valued customer, you're important to us," and you wait for 45 minutes on the
then you're
phone.
done.
It's crazy. It's crazy. So yeah, we talk a lot about trying to make sure the customer's number one, really, first call resolution. And I joke, and you're a CEO. I'm curious on your take on this. I tell people I've got 3 jobs. It's pretty simple. I'm responsible for the vision. I'm responsible for the financial performance. But what nobody talks about, it's the people and culture you surround yourself with. Because if we just say do this, you don't have great people executing on the vision, the financial
gonna
performance isn't going to be there. No.
Well, you've done an incredible job with HydraFacial.
Thanks.
And with everything else you've done.
Well, we've had a lot of friends helping along the way.
Yeah, a lot of the people, just for example, me, the quick story dovetailing into the booster with you
Yeah.
guys.
Yeah.
I've always wanted to do skincare. As a facial plastic surgeon, different than a dermatologist, I'm working with the skin all the time underneath.
Yeah.
And to me, I'm really into exfoliation, hydration.
Mhm.
And now it's been about 5 years, I think, for NassifMD. And I have a great small team.
Yeah.
Now, again, we're more consumer-based.
Mm-hmm.
And we have like 15 or 16 different products already. And,
Yeah.
And again, with the right people, the right products, I've been able to actually build something as
Yeah.
a small entrepreneur.
Yeah.
And one of the things I've always wanted to do is, because we've had HydraFacial machine in right when you guys opened up, when
Yep.
HydraFacial came out.
Yep.
And And then after years, I started seeing these boosters.
Yeah.
And I always said, I want to have one of those boosters. I want to be up there.
Yeah.
You know, it's kind of almost like, you know, putting that big trophy on your mantle.
Yeah. It was.
And after all the hard work
We
and
got
with the
one.
great product, the Hydraglucan, and with working with you guys, we did it. We launched
did.
it.
It's awesome. I'll tell you what, when it came to my attention that you were interested in doing that, that was an easy decision. You know, there was no committee. It was like, we're doing this. And it's off to Gangbuster start. So I think one of the things that surprised us, we knew it would get a lot of interest outside. I mean, your brand is very international through the TV and your speaking and just being known as a well-known physician. But we've had a lot of interest domestically too, which is good. That's hard for a physician to accomplish sometimes, because sometimes doctors will say, I don't want to use this other guy's. I'm not wearing that guy's name on my jersey.
Well,
But we're getting a lot of interest from physicians.
which was something that I thought immediately that we were going to do, because I'm in 166 countries.
Okay. Yeah.
And I mean, U.S. is number 1, 2 is U.K.,
Okay.
3 I think is Australia,
Yeah.
then Africa, I mean, going down the line.
Yeah.
And I kind of knew that doctors' offices internationally, I thought we would do okay.
Yeah.
Spas, we would do okay. Spas out here, I even thought we would do pretty good,
Yeah.
but I did not think that we would do well in the doctors' offices.
One of the things I think
but
we
we-
have, I know that we have a lot of estheticians that are fans of yours. You know, we have so many awesome, I mean, about 2/3 of our customers are physician-led practices. Internationally, it's all physician-led for the most part. But we really focus on the esthetician, and it's amazing when you talk to her. One, she's very influential inside the practice, but you got a lot of huge fans out there that are estheticians. So I think part of that uptake is, hey, this is a great booster. I love this guy, and I'm using this for my client or my patient on the HydraFacial machine. So that's working out great. Hopefully, it's a wonderful partnership. We were having lunch just a few minutes ago, and this man's a constant learner. He's asking me, what about this country? What about that country? And I'll send him on the phone with the CEO, and I just really appreciate that. You always seem very inquisitive, always trying to better yourself. And what you call a small business, a lot of people would say is a very substantial business, and it's impressive to watch it grow.
Well, thank you, my friend. As a matter of fact, you know, it's interesting. Speaking of that and the growth, since you mentioned that, and first of all, thank all of you estheticians and doctors out there. I hope you, and if you have any questions, you can call me. Call my office, call this guy here, call all the great people here. But one thing that my fellows, I have a fellowship where I train, we have 2 doctors per year.
Okay.
You know, I have another doctor that we work with. And we have fellows that are head and neck surgeons that do a year of facial plastics. And one thing I think, no matter what, I'm 58, so I'm kind of getting up there. But in regards to surgery, and I try to do this with especially skincare, I'm constantly learning.
Yeah.
I'm never stuck. I'm constantly changing, learning. How could I improve? And I think that's one thing, too, for all the small business owners. You got to keep growing. You got to actually open yourself up to that. And you're going to fail. You're going to make mistakes, but that's how you learn.
Particularly the change, the way technology changes now. I mean, speaking of growth and things changing, I mean, this Zoom boom. I'm real curious on your take. You know, I know that I've been in this business for a long time now. You know, I started with Thermage, which became Solta, and now HydraFacial. And, you know, a lot of my buddies at the time were like, you're in that girly business, that skincare business, right? And I've noticed, I'm 51. All of a sudden, my friends at the golf club that used to make fun of me are very interested in skincare. And the pandemic seems to have accelerated their infatuation. I was joking that we used to tease millennials for being, you know, narcissists. They were just visionaries, right? They were taking selfies, looking at themselves, saying, "I need these things." So I'm curious on your take, if you've seen the Zoom boom and, you know, the questions that come your way from your fellow golf buddies, as well as just your take in general.
I think the Zoom boom, especially tech neck, is, I mean, since the beginning of COVID, I mean, social media before, though, we had a little bit of the social media, especially for the millennials, and were really still hitting us for the last 2-3 years, because everyone filtering themselves, and they were doing, they were super, you know, taking those filters, and it was kind of what we call that a selfie dysmorphia. They're overdoing it. And so it started years ago, but then what happened with COVID and everyone going on Zoom for business, men, women, all ages, it has increased in regards to more the lines in your face, the texture of your skin, how you look, how you present. And so 100% correct in regards to my golf buddies and men in general. And now even some of the Gen Zers about their skin,
Absolutely.
their skin, the kids, is now taking care of your skin is more important than ever. Because what you're doing is you're staring at yourself all the time.
Yeah.
And when you're on that call and it's a 2-hour business call,
Yeah. Well, there's
you're
20
staring.
people on. 20 people on.
Yeah,
we
you're
know we're all
staring.
staring at ourselves, right? We're
Just kinda
we're
focus
total all
on, look
narcissists.
at that, yeah.
No, it's crazy.
So huge. And that's why, what's great about, just in general with the machine, the HydraFacial machine, is the way to, like, for example, all my patients have to prep before and after with this.
Interesting.
Because for the exfoliation, cleaning out all the blackheads and whiteheads,
Yeah.
especially in the nose,
Yeah.
especially in the face. That with the exfoliation, and then with hydration, for example, my booster. And you listen, you got great boosters. You got great products overall, and you have great partners.
Thanks.
Not just me. And that is some way more than anything to really take care of your skin.
Yeah.
Besides good skincare at home, but you need something like this here.
Yeah,
You need
professional
it.
grade. It's interesting you say that because I've been on Zoom. A lot of people know Vesper has come along to acquire the HydraFacial company, take us public, and so Brent Saunders is my new chairman.
Yeah, good old Brent.
We were on a call the other day with several people, our investor relations firm, and I'd had a long week. I hadn't had a HydraFacial for a month, and I joked about something about being a little tired, and they said, basically, you look like shit, Clint. And you look like you need a vacation. And I'm like, I look up there, and I'm like, I do look like that.
Yeah.
I'm walking down here through our HFX training center, and Clara, one of my favorites who takes care of me, she's like, you really look rough. Get in here.
So you had a HydraFacial?
Yeah, so I had a HydraFacial, and that night I go out for a socially distanced dinner with 3 of my friends, and all 3 of them at separate times commented. One said, you look
good."
tan.
Yeah.
You've been on vacation. Why do you look so good? I thought that you've been working hard. And it feels great. You look great immediately. We show you the gunky, and we've got great partners, so that we just hope to put people along the journey of great skincare.
Yeah.
So it's that simple.
It is. I mean, number one, here's the other important thing too. If you're going to use skincare, whether it's mine or anyone else's, for it to work, you can't put it on that much of debris, clog pores, sunscreen, dead skin cells, all that. You got to clean all that off.
Yeah. It's interesting you say that. When I talk with guys, they'll be like, why should I do this? I go, you remember looking at your grandfather's nose? It kept getting bigger and it had blackheads, right? And I don't have a small nose. My family, half of them is Russian. So I remember my grandfather that way. And when I tell men that, I say, you won't have to have that nose with big blackheads. And your grandkids looking at yours that way, and they're like, I'm there.
Yep, come and get these extractions.
Yeah, no, it's incredible. It's good. Maybe switching gears a little bit. I think you're aware that we talk about the HydraFacial company really creating the category of beauty health. And I'd love to get your opinion on this, because when I'm describing that, people give me that Cocker Spaniel look a little bit. Like, are you a medical aesthetics company? Are you a skincare company? And I said, we're a beauty health company. And they're like, what's that? And so if we think about HydraFacial, we're in Sephora with the Perk by HydraFacial. You're using it at your office to prep people for surgery or to take care of their skin afterwards. And very few companies have the ability to do that. And after 15 years of hearing skincare companies with lotions and potions in a bottle, but not a lot of scientific evidence, and the medical device company saying something's wrong with you, your face is formed wrong, you've got wrinkles, you've got brown spots, come get something fixed. My view is that healthy skin's beautiful skin. Beautiful skin makes you feel great. You feel confident. And the way we've been positioned at HydraFacial is we're probably the most efficacious thing in like the skincare category, what above the lotions and potions. But on the medical device side, we're probably the most approachable thing. Price point wise, it's non-invasive. And so it's less scary for people to cross over and end up in your office maybe talking about their needs. And it gives people that maybe in a confusing retail landscape the ability to know that something's really happening. What's your thoughts around beauty health as a category in general? Am I totally full of baloney? I'm okay with that too.
No, the reason why this makes sense, because the entry level into people that don't do much about their skin or don't do anything in a professional environment, whether it's Sephora, medical spa, or a doctor's office, this is a no-brainer.
Yeah.
Because what you're doing is you're taking care of your skin. It's not invasive.
Yeah.
The price point either for the spa or the doctor having in their office is incredible from that aspect. But then from the consumer standpoint, the price-wise to have this done is absolutely fantastic and eases in right into getting your skin ready to go.
Yeah.
Because right now you need to have excellent skin for success.
Yeah.
You do, especially now more and more, as we just talked about with anything, since we're all virtual. So your approach is something that all of us probably wouldn't even think about.
Hmm.
And especially it's, I think for, the HydraFacial company to incorporate that and adopt it, I think that, out of all the companies, other companies may have a hard time doing that because of this is like a no-brainer, the HydraFacial machine.
Yeah. Yeah.
That's what I think. I think
Yeah.
you did a great job.
Thanks. It's interesting, when I was doing, I did diligence on the company when we looked at acquiring it with my private equity backers. And I went to a medical arts building in Newport Beach. And on the ground floor was a medical spa.
Mm-hmm.
And on the next floor was a dermatologist's office. And the next floor was a plastic surgeon's office,
Mm-hmm.
right? And all of them had HydraFacial. And I was trying to figure this out in my head, like, it was a day spa. How's a day spa have this, a derm and a plastic, how they use it? And it was fascinating. We visited all three with the local rep. And the day spa, it was their primary, like, breadwinner.
Yep.
It was the top of the food chain.
Mm-hmm.
And I went to the derm, and she said, hey, I tell people I'm not taking you as a patient unless you put a HydraFacial regimen in there, because why do you want me doing stuff if you're not taking care of the canvas? And then I visited the plastic surgeon. We sat for a few minutes. He goes, I really don't know what the hell the product does. He goes, go talk to Susie. And
Who's like the esthetician?
Yeah, and then he goes, I don't know, Susie sells the hell out of that thing though, right?
Yeah.
And I go, okay, and I'm trying to figure this out. And I said, Susie, tell me about, how you guys use HydraFacial. She goes, oh, it's simple. He really doesn't know how we position it. We just say, you just bought a Ferrari from the guy. Would you put crappy gasoline in it?
Yeah.
Crappy fuel?
That's a good way to look at it.
So take care of your Ferrari. And, it maybe is not everybody's metaphor, but I thought it was a pretty good analog for how different specialties use it in their practice. So we try not to judge that. We just want everybody to have clean, healthy skin.
I mean, it's so what we do, or what I say, is because, again, as a facial plastic surgeon, I say, listen, if I'm going to lift up your skin, I'm going to tighten it, I'm going to elevate it, I'm going to do this and that, well, that's going to look pretty average. Even though my lift will be fantastic, but if your skin is dull, remember, it's the lackluster appearance, just like how your friend
when
said
they called
look,
me out on
it's that lackluster appearance and there's no luminosity, that's the glow.
Yeah.
So that's why you need a procedure like this, followed up, of course, with in my office. It's, even though we have 3 or 4 lines, but it's my line, because you got to clean the skin, and then you need a system after to continue to take care of your skin, whether it's HydraFacial once a month.
Yeah.
I mean, I don't know what the other numbers are, but that's what I think. And the HydraFacialist, and slash esthetician, and the nurse practitioner, but all the practitioner doctors in my office, we always know about. Listen, you got to do both, the outside and the inside.
Yeah, that's great. Speaking of that, I'm fascinated. I used the term frenemies the other day. I mean, surgeons are typically lone wolves, right? For whatever reason, it's tough to get them to work in a group, right? Our industry, everybody seems to want to win-lose. And yet I've watched you in your career working with us, being able to transition to TV with also having a respectable private practice. You seem to be just a person who's full of abundance. You seem to pay it forward. The people around you, I just was on the phone with your CEO. She clearly has a great relationship with you. Our space seems to be very I win, you lose. And in my view is it's kept aesthetics relatively small, because once people find out what we do, everybody wants it. What's your view on this idea of, or maybe I'll say it differently, we call ourselves an and company. And the reason we say that is we say we don't have a competitor. Our competition is awareness. We need more people aware of a HydraFacial. Once they get a HydraFacial, they're aware of good skincare, and they're off on the journey. And eventually they'll end up in your office. But we've chosen that, and it's worked really well for us. What's your view on competition versus us working together to get more consumers aware of all of the benefits of things that we can do for them, plastic surgery to medical grade skincare and HydraFacial?
When I heard about you doing this and the whole introduction of consumer to skin. And even though this is the gateway, HydraFacial, but no matter what, it leads to other things for all other offices, from doctors' offices. So I think that the competition when it comes to good skincare is really, there shouldn't be competition. It's every consumer that goes into, whether it's the derm office, the plastic surgeon, the med spa, whatever it is, or wherever it is, that actually should lead them into that path of skincare beauty. So when you say you won or I won, you lose, that shouldn't even be incorporated into any thoughts, which you don't. Other, medical, maybe device companies, other things may think about that because, again, it's a competition of what you do. But the thing is, this is entry level. whichever one needs.
Yeah.
And then from there, whether it's lasers or different types of thick peels,
Yeah.
or strong peels or surgery, it's everyone actually wins.
Yeah.
You win, we all win.
Yeah. Yeah.
That's the way I look at it.
No, it's very much our view. Well, you've been very gracious with your time today. I think it's safe to say we played golf a couple times together. You're a better businessman than you are a golfer, and I think I resemble that compliment. So I don't think you want your surgeon to be a scratch golfer.
I know, but I got to tell you though, I mean, my goal, I have to say, I'm addicted to it.
I am too.
And even but you're a very good golfer though, and all I know is as long as I can go out and relax and play a little bit every week or so. Of course, I'll never become great because I work too darn hard.
No. Well, it's amazing. Your success is well deserved. I think we're right at the start of NassifMD and the HydraFacial Serum Booster. This thing's off to a great partnership, and we're going to go global.
I'm excited about
So,
that,
thanks so
especially with
much.
our little skin collection kit with 3 of the products
Yeah.
and the Hydraglucan. So I'm excited. So they
Yeah.
get actually skincare and the Hydraglucan.
Yeah, well, I can't say we have to be neutral, right? We're like the Keurig, and we've got it, whether it's Pete's or Starbucks or Dunkin' Donuts. But I do secretly hear about your fan base, both here in the HydraFacial company and when I'm outside. So I know this can be
I
a
love
huge
it.
success, and
I'm
thank you
excited.
for your
Well,
partnership.
hey, listen, I'm excited and thank you for having me.
You
And
bet.
I love you guys.
You as well. Cheers.